Hello, I'm Dr. Bryana Andert. I am a family physician here at the Noah Medical Center, and wanted to come today to give a little bit of an update on what's happening in our community regarding COVID-19. Here at the Medical Center, we have been working very closely with Brown County Public Health, and we're really thankful to have that solid relationship with them. You know, a pandemic like COVID-19 really is a public health emergency, and so that is something that is in the realm of what our public health staff are trained to deal with, and so we really thank them for the relationships that they have with our various community partners and the messaging that they're making sure to get out to those community partners so that our employees and all of that are really aware of what's going on and what some of the most up-to-date recommendations are. I think for all of us here in Brown County, while we're not surprised that we, do now have a confirmed positive case, it does make it feel a little bit different now that we know that really there are those confirmed cases here in our county. It just makes it feel all the more real for many of us. So there has been a little bit of an increase in questions that we've been seeing over this past week, I think given that those 2 positive cases did come out in recent days. So a couple things that I just want to reiterate for people. Again, for the majority of people, for probably about 80% of individuals, if you become infected with COVID-19, your symptoms are going to be mild. It's going to maybe feel like a bad cold or feel sort of like maybe an influenza-like illness if you've had influenza in the past. So you're going to have symptoms probably of fever, cough, maybe some fatigue, muscle aches and pains, maybe some sore throat, possibly some shortness of breath. For people who are having mild symptoms, it is still going to be our recommendation that if those symptoms are mild and you're feeling comfortable with managing those symptoms at home, that is our recommendation. So you do not have to be seen at the medical center if your symptoms are mild. Of course, we are here to help walk you through things if you have concerns, but if your symptoms are mild, I would say treat supportively and very reasonable to stay at home. For the majority of people with mild symptoms, there's also not going to be a recommendation for us to test. Some unique populations would be healthcare workers. Obviously, we want to make sure that we do know if a healthcare worker were infected. There may be some unique cases with child care workers, but the key for testing, if testing is going to be recommended in people with mild symptoms, it's really going to have to do about whether we need to give them more advising on how long they should stay home and how much they should quarantine and those kind of things. So if you're already are off of work because of the stay-at-home order, if you are quarantining in your house already for the most part, social distancing, and you have mild symptoms, our recommendation would be that you're going to stay home and you're going to treat yourself supportively. Supportive cares are going to include ibuprofen, Tylenol, fluids, rest, making sure that you're getting good nutrition. And so there would be a benefit to have some of those supplies on hand at home. I think people initially when the pandemic started definitely went and cleared the shelves of a lot of stuff. You probably don't need to have that much items on hand, but it would be reasonable to have somewhere from 7 to 14 days of supplies on hand at home so that if you do become ill, you wouldn't have to go out to the store if you don't need to. The recommendations for how long to stay at home if you are feeling ill are going to be 7 days or a minimum of 3 days of having improvement of your symptoms. And it's going to be whichever of those 2 is longer. Essentially, if you were sick for 6 days, or maybe you were even sick for 7 days, then obviously you're going to have to stay home for, closer to 9 or 10 days. We want to have 3 days of you feeling like you are not having fever, and that's going to be, of course, without also taking Tylenol or ibuprofen, and also that you're maybe having improvement in the other physical symptoms. So improvement in the cough or shortness of breath or sore throat if you were having those symptoms. About 15% of patients are maybe going to have more moderate symptoms, so maybe more of the shortness of breath or chest heaviness, maybe a little bit more respiratory involvement with their symptoms. For the moderate symptoms, we certainly are here to service you at the Noah Medical Center and also at our Springfield clinic. And so we would have a few options for how you may receive care if your symptoms are more moderate and you're concerned about whether you should be tested, whether you maybe need any medications, etc. So with moderate symptoms, it would be reasonable to start with a telephone visit or to start with a virtual visit with one of our physicians or APPs. If you were interested in setting up a virtual visit, and if you are someone who really knows what you're doing with your MyChart app, you can set up a visit with your physician or APP through the MyChart app. It may be easier for a number of individuals to just call us here at the medical center or at Springfield Clinic. And those phone numbers are going to be for here at the Noel Medical Center, 507-217-5011, and for the Springfield Clinic, 507-723-6201. And our registration and scheduling staff will be more than happy to set you up with a virtual visit or the second option, which is a telephone visit. Both of those visits are billable services, so they are options where your physician or your APP can provide you care through a telephone or through a virtual option, and it can be run through your insurance. And that's going to be an avenue to maybe just speak with someone and see whether they might recommend that you come in to be seen further and possibly tested, or if they may just recommend that you stay home and monitor symptoms and self-isolate. The other option, if you're having moderate symptoms, again, more of some of the respiratory things, would be to be seen at our walk-in clinic. Our walk-in clinic is essentially seeing all of the respiratory cases currently here at the medical center, and there will be a similar type of care option at the Springfield Clinic. And so those staff, those physicians, and those APPs are happy to see you and discuss your symptoms further, determine if testing might be warranted, and if any kind of a treatment is needed. About 5% of people with COVID-19 are going to have more severe symptoms, and the more severe symptoms are really going to be respiratory things in particular that we worry about, and so more respiratory distress or potentially even respiratory failure. And those are the type of cases that, of course, are going to want to be seen through the emergency room. The message, of course, is going to be that if you are unable to safely get yourself here to the medical center, we would want you to call 911 and to call for an ambulance. The more severe cases and the respiratory failure cases are the types of people who are going to need ICU level care, potentially even ventilator support. So we would, of course, want you to be seen and cared for if you are having those severe symptoms. A couple other things to just touch on real briefly today. People have been asking what kind of things might we do at home to just help protect ourselves. So number one, if you are not sick and you're at home, you are already doing one of the best things that you can by staying at home and by really socially distancing and following those stay-at-home order recommendations. The other thing is going to be hand hygiene. You want to really limit touching your face as well. You want to disinfect commonly touched surfaces. And then if you are sick, obviously we want to kind of ramp it up a notch, maybe hand hygiene even more, covering your cough. If you live with other individuals in your home, you may want to isolate yourself even from some of those individuals. I would kind of give a plug for if you do have a family member who is sick, that we then would maybe recommend that everyone in the household be even a little bit more strict with social isolation and social distancing. Of course, since 80% of the symptoms are going to be mild, there are probably going to be a lot of people in our community who are going to have COVID-19 but are not going to be tested, and so we're not going to really know for sure. So when you are having symptoms, what we're going to say is err on the side of caution. That individual plus individuals that they directly live with should really be making sure to limit their time out in the community. And then one other little thing I want to touch on quick before I sign off here is just in regards to some of the questions and concerns that we've been seeing and hearing from patients in regards to whether they might be high risk. So if you have concerns about whether you might be high risk, certainly you can discuss that with your physician or your APP. If you have concerns, you can also discuss with your employer. A number of employers currently have reasonable accommodation processes that employees can go through, and most of that truthfully does not need a note from your doctor. The other comment on notes is that per the Centers for Disease Control, the recommendations at this point really are that employers would not recommend employees need a note if they are sick to be out of work, or need a note if they've been sick to come back to work. As you can imagine, there are probably going to be hundreds and hundreds of people in our communities that are going to potentially get sick in the coming weeks to months. And if we had to write doctor notes for all of them, that would be a whole lot of doctor notes. So per the CDC recommendations, doctor notes are not needed in this time. If you have questions about that, or if you feel like your employer wasn't clear on that, I would absolutely encourage you to reach out to Brown County Public Health, because that is part of what they've been working really hard with our various community partners to make sure that that messaging about what the recommendations are for employees has been really clear. I wish everyone just health, and I feel confident that we can all get through this together as a community. And we are always here for you here at the Medical Center, happy to answer questions and happy to see you virtually and telephone and in face if we need to as well.